feels right, all the attraction.
The first exercise we're going to be talking about today is the glute bridge. So in order to do a glute bridge, we can see Haley demonstrating here that she will be in a hook-lying position with her knees bent. She is utilizing a posterior pelvic tilt for a neutral spine. So basically she's just tilting her pelvis forward, which kind of takes the back muscles out of the equation. And then she's lifting her hips. She's squeezing her glutes at the top and keeping her core tight, and then she will lower down. So some things to consider for this exercise are utilizing a posterior pelvic tilt for a neutral spine, and then keeping the core tight as well. So again, this kind of isolates the prime movers of hip extension, and in this exercise specifically, we're focusing on the glutes. In order to progress this exercise, we would add weights to the hips, as you can see Haley doing here. This exercise could also be done utilizing a single leg. Furthermore, a band can be placed just above the knees on the thighs to kind of activate the abductors. More reps could be included as well to increase the overall intensity of the exercise. And then we could also increase time under tension by slowing the exercise down. In order to regress this exercise, we could decrease the range of motion, especially if a patient cannot get their hips up that high or if it's painful. And that's what we can see Haley doing here. If a patient were to have osteoarthritis, we could utilize less weight, which would decrease the compression of the spine during this exercise, or again, decrease that range of motion. And as for a soft tissue injury, the patient could be in a long bridge position, which is when the heels are out a bit further, which decreases the overall angle of the hips and the knee, which in turn decreases the shear forces in this exercise. As for the kinetic and kinematic situation, we're going to talk about the kinetics a bit more in detail with a free body diagram. However, I did want to address that the center of mass in this case is the mid-thigh region, and the base of support is about hip distance apart at the feet. In this exercise, the participant is also supported up in the thoracic spine region because it also contacts the ground. As for the kinematics of this exercise, the type of motion is rotation, which occurs at the hip joint. We are utilizing a 2D XY coordinate system. The plane and axis is a sagittal plane and a mediolateral axis. That's where the rotation is occurring because it is hip extension. We're going to address the osteo and arthrokinematics momentarily as well. But the joint classification is a ball and socket joint, and it is also a triaxial joint because of how many different ways the hip joint can move. As for open and closed packed positions, when the hips are elevated during this exercise, that is a closed packed position. And when hips are on the floor, this is an open packed position. And overall, the exercise itself is a closed kinetic chain exercise. As for the osteokinematics, this is the gross motion that occurs at the joint. So the overall motion is hip extension at the acetabulo-femoral joint, and this occurs along the sagittal plane and the mediolateral axis, which is where active rotation of the hip joint is occurring. As for the arthrokinematics, this is the motion between the articular surfaces, and a roll and slide combined motion is occurring at the hip joint. The convex and concave roll also applies here because the femur is convex in the acetabulum. So this means that the roll and slide that are occurring at the hip joint, that combined motion, occurs in opposite directions. Now, as we begin to address the free body diagram, I'd like to make note that this is a third class lever, with the fulcrum being shown as the axis in red, the effort coming from the muscle force of the glutes in blue, and then the load being the center of gravity shown in pink. The segment of interest itself is in yellow, which is the thigh segment relative to the trunk. And then we are assuming that this action is occurring in a 2D plane that is not actively in motion, and we are strictly looking at the muscle force of the glutes. Now, when it comes to internal forces, we can see on the free body diagram the muscle force of the gluteus maximus shown in blue, as well as the joint reaction force shown in purple. Some other internal forces that occur that might not be shown on the free body diagram include the force of the gluteus minimus and medius, the rectus abdominis and transversus abdominis in the core, the erector spinae in the back, the hamstrings, which are a prime mover of hip extension, the quadriceps muscles, the femur and pelvis, and of course, ligaments. Some external forces that we can see in the free body diagram include gravity, which is again shown in pink, ground reaction forces, which are shown in green, that are acting on the tibia that are then acting on the femur. We can see the torque drawn in white, which is a positive torque going in a counterclockwise direction. As such, the highest external torque is found when the hips are lifted in the air, and the lowest external force is found when the hips are down on the ground. Another external force that is not included in this free body diagram would be weight, which would be included if she were to have weight in order to progress this exercise. We also see the internal and external moment arms in light pink. The internal moment arm is shown from the start of the muscle force of the glutes to the axis of rotation. And the external moment arm is shown from the force of gravity again to the center of rotation.
Stand with a stable wide stance just over shoulder width apart with your knees slightly flexed to around 15 degrees, your scapula slightly retracted and spine in neutral, braced with the abdominal muscles. First, hinge at the hips, flexing forward, maintaining a neutral spine. Then hinge your hips, bending back, pulling from the hips through the heel, feeling a stretch in the hamstrings and gluteus maximus, maintaining a neutral spine. Think about you're moving your hips into a wall or your face to the table with your eyes on the floor, a few feet in front to maintain a neutral cervical spine. Don't bend at the trunk, only the hips.
So for this exercise, we will focus our analysis onto our segment of interest, which is the pelvis and the thorax, as the thigh, lower leg, and the foot are relatively fixed. So for the osteokinematics, there's 3 degrees of freedom with rotational movement in the sagittal plane about a medial lateral axis in this exercise. So for the arthrokinematics, it's a ball and socket joint between the acetabulum of the hip bone and the head of the femur. It is a triaxial joint with a roll and a glide. The concave acetabulum moves on the convex head of the femur in rotation of the sacrum and pelvis segment, with a roll and a slide in the same direction. As far as the internal forces, we have the gluteus maximus, the adductor magnus, mostly the hamstring portion of that, the semitendinosus, semimembranosus, biceps femoris, erector spinae, the iliopsoas, the quadriceps, and the rectus abdominis. But for our analysis, we're going to be focusing on the muscle force of the hamstrings as a whole, which we will generally consider to be attaching back here on the ischial tuberosity. As far as the internal stabilizers, we have the iliofemoral ligament, the ischiofemoral ligament, the pubofemoral ligament, the glenoid labrum, the synovial membrane, the acetabulum, pelvic bones, sacrospinous ligaments, anterior and posterior sacroiliac ligaments, the sacrotuberous ligaments, and the ligament to the head of the femur. The joint is in open packed position when the torso and hip segment is maximally bent forward and at the end range of the hip hinge, and close packed when the hip is in full extension, as the capsular ligaments, namely the iliofemoral ligament, ischiofemoral ligament, and pubofemoral ligament, all become taut when you're in full hip extension. So for the external forces in this exercise, we have the force of gravity and the weight of the torso / pelvis segment, a weight if you're holding it in front of you, and the normal force of the ground pushing up on the feet, which we'll ignore this for our analysis since we're only looking at the pelvis and thorax. The external torque is going to be at its highest when the hinge is at maximum, so when the person's bent over as far as they can, and then it's lowest when standing in neutral. And this is due to the moment arm of the force of gravity being at its highest when in full hip hinge. So onto our analysis. We're looking at a first class lever. So we have the load here, which is just going to be the force of gravity on our center of mass, the hip joint in the middle, and then the hamstring attachment on the ischial tuberosity back here, creating our internal force of muscle. Some assumptions that we're making in our analysis is that it's in the 2D plane. We're only focusing on the hamstring, so not really looking at the gluteus maximus. The spine in our analysis, we're just considering to be a fixed segment. And the force of both legs and hamstrings are going to be summed into one muscle force called F. And then we're assuming equal distribution between both limbs. And we're not going to be analyzing the normal force of the ground going up into the hip, only looking at the overall joint reaction force at the acetabular-femoral joint. So for the kinetic analysis, the moment arm of gravity on the center of mass is roughly like 4 or 5 times as much as the moment arm of the hamstring force. So therefore, at peak hip hinge, significantly more force is needed to counteract the torque created by the external force of gravity on the segment. And that's just based on the equation for torque, which is torque equals force times the moment arm. So adding in a weight, this would affect the external torque, the weight force, the muscle force, and internal torque needed to rotate the segment. And it would also increase the joint reaction force in both the X and Y plane and increase the compressive and shear forces on the joint. To decrease the overall compressive force on the joint, use an assistive device to create 2 more points of contact, lessening the weight transferred through the hip joint and decreasing the amount of force exerted on the joint by lessening the overall hamstring force needed to rotate the hip/torso segment posteriorly. As there would be a lesser muscle force, there would in turn be a lower joint reaction force in both the X and Y direction, thereby decreasing the amount of compression on the acetabulo-femoral joint and also less shear force. Have the patient lift weight off the table and perform an isometric hold in a position of slight flexion, as the peak amount of shear stress would be at full hip flexion. To decrease the amount of shear forces on the joint, reduce the amount of rotation in the hip hinge, thereby decreasing the amount of force being directed vertically on the acetabulum. The peak amount of shear forces on the hip segment is in full flexion. So trying to match the load of the body weight and gravity in full flexion, we can use a dumbbell weight with less hip hinge, and one would shorten the moment arm, but achieve the same amount of muscle force exerted to rotate the segment, but lessen the overall shear forces because of just that lowered range of motion. So decreasing the range of motion in an isotonic hold would also allow the muscle to act with a minimum shear or sliding between the head of the femur and the acetabulum.
Even if you can't dance, just hold my hips while I roll my.
We are going to be looking at a quadruped kickback exercise, which is an open chain exercise. In this video, Steve is setting up on his hands and knees with his hands underneath his shoulders and his knees underneath his hips. He kicks one leg upward with the knee bent to 90 degrees, driving his heel straight up into the ceiling. He's squeezing his glutes as he lifts his leg and drives his heel upward. Steve holds for 1 to 2 seconds at the top to contract the glutes before lowering back down. A few special considerations when doing this exercise is to make sure to keep your arms straight as you kick back and keep your abs engaged. Do not arch the back, keep it straight. Try to get the quad to stay parallel to the ground with the hips square to the ground. Do not rotate the hips open as you kick back. The height of the kickback does not matter as long as you feel your hips extend and your glutes engage. For this exercise, we will focus our analysis on our segment of interest, the thigh relative to the trunk, with the knee and lower leg flexed to 90 degrees. The osteokinematics for quadruped kickbacks include active hip extension and flexion affecting the acetabulo-femoral joint, which is a ball and socket, synovial, and triaxial joint, and is rotating in the sagittal plane about a mediolateral axis. The arthrokinematics of this exercise include a roll and glide motion of the ball and socket joint during femur on acetabular extension. The roll and glide comes from the convex surface of the femur onto the concave surface of the acetabulum, and this occurs in opposite directions. For our analysis, we will focus on the muscle force of the hamstring as a whole, specifically the insertion over the posterior knee joint into the tibia or fibula. In this exercise, the total muscle forces include the glutes, the abdominals, erector spinae, hamstrings, quads, iliopsoas, adductor magnus, triceps, and the scapular stabilizers, which include the rhomboids, serratus anterior, and the latissimus dorsi. The bone force is the femur and the pelvis, also known as the acetabulum, and the ligamental forces, the glenoid labrum, the pubofemoral ligament, the ischiofemoral ligament, iliofemoral ligament, the sacrospinous ligaments, sacroiliac ligaments, sacrotuberous ligaments, and the ligament of the head of the femur. And finally, we have our joint capsule force, which includes the synovial membrane, synovial lining, and synovial fluid. In this exercise, the joint is close packed when the hip segment is flexed forward or perpendicular to the ground, and the joint is close packed when the hip segment is in full extension or parallel to the ground. And this is due to the capsular ligaments mentioned above becoming taut in this position. The external forces in this exercise include gravity and the normal force of the ground pushing up on the hands and knee, along with the weight of the body segment. Ankle weights and resistance bands can also be added as external forces. The highest external torque occurs when the hip is in full extension or at 0 degrees, and the lowest external torque occurs when the hip is on all fours, or when the hip is flexed to 90. In this diagram, the center of mass is at the knee joint, and the base of support is the hands and the knee on the ground. The muscle force is occurring from the pull of the hamstring, while the force of gravity occurs on the knee joint itself. The moment arm of gravity is shown as dark blue, and the moment arm of the hamstring force is shown as dark green, with the joint reaction force in light blue. The hip joint is a third-class lever. The force of the effort is located between the fulcrum and the force of the load. Assumptions of this diagram includes a 2D plane solely focusing on the involvement of the hamstrings with the spine of the segment fixed. The overall joint reaction force is what is focused on in this depiction, excluding the normal ground force. For the kinetic analysis, the moment arm of the force of gravity on the center of mass is about 2 times as much as the moment arm of the hamstring force, causing more force to be needed to counteract the torque created by the external force of gravity on the segment in full hip extension. To clinically progress this exercise, resistance bands can be added around the feet and or hands to increase the weight force, muscle force, and joint reaction force in both the X and Y plane, along with increasing compressive and shear forces. Ankle weights can also be added to affecting these factors as well. We can also make this exercise more difficult by increasing the reps and sets, along with increasing time under tension with a longer hold and full hip extension. Now, if a patient has arthritis and I want to decrease the compressive forces on the joint, I would decrease or get rid of the ankle weights, or use a TheraBand to help passively pull the hip into extension. These adjustments reduce the amount of force going through the joint. If a patient has a soft tissue injury and I want to keep the load on the muscle the same with less shear, I would change the angle of the hip in this exercise by having the patient stop before going into full hip extension. As the angle of the hip decreases, there is less shear force occurring.